Thank you for taking the time to attend our presentation, Connecting to an HIE. Our speaker today is Rob English. Rob is the Director and Senior Consultant of Iatric Systems Professional Services. Rob is responsible for a wide range of project management and implementation projects across all IT platforms. His background includes extensive implementation, programming, and integration experience with EMPIs, including IBM Initiate, and integration engines such as Cloverleaf. Rob has over 20 years of healthcare experience. And now I'll turn it over to Rob.
Thank you, Michelle. And as you guys will see, there's a poll question that we've started with. And if you wouldn't mind just answering that, click yes or no. And see, has your organization selected an HIE strategy? Maybe not necessarily implemented one yet, but actually selected a strategy. We'll take a couple of minutes here, or sorry, a couple of seconds here, see if we get some votes. We have any votes there, Michelle?
Yes, I will go ahead and close it.
And 100% have selected a strategy. Great. And we'll see if, maybe as we go through, and there might be some questions at the end from an implementation perspective and how that's going for you. So we'll go over the agenda briefly here. What we want to look at today are the benefits of HIE connectivity, what you'll gain as a provider of information to an HIE and a receiver of information to an HIE. Hopefully the picture of an HIE success story, benefits of HIEs, which we'll go into, current ONC HIE priorities, what the ONC is set up as goals and things that HIEs should perform, how to select an HIE, and then any questions for your EHR or EMR. So the benefits of HIE connectivity, just to look at a few of these, HIE save time and cost by hopefully streamlining your provider workflows. So hopefully integrating your EMR or EHR into their solution for you to receive additional data into your EMR. So we want to look at streamlining provider workflows, hopefully reduce your IT staff maintenance. So, the next bullet also shows that reduce our connections, which should hopefully reduce any support maintenance that your IT staff has to do to look at point-to-point connections, eliminate a lot of those, and get more data available to you through just one connection. And provides a more complete medical history. So we want to aggregate all the clinical history for a specific patient, not just through one participant or two participants, but hopefully a multitude of providers of information into an HIE. And it could be immunization gateways, it could be a VA, it could be many, many things that you would gain a benefit of a more complete medical history. What I'd like to do here is basically walk you through a scenario, and I'm going to include you, the consumer, as part of this story. And so you or me have been found on the street unconscious. We're just lying there, knocked out, no idea how we got there. Someone stumbles upon us and calls 911. 911 sends out an emergency, an ambulance, and they arrive, and the EMT starts looking through personal belongings to see if they can find out anything about you. Give me a driver's license, give me your phone with ICE, anything about you in there. They do find your ID, right, your driver's license, and they put in your name, your address, your date of birth on there, and they have a mobile device that they can enter all that information into. And that is hopefully connected to a statewide HIE or a regional HIE in which they search this information and they find a match. And then once they receive a match, the EMT is asked, well, we have a lot of other information about this person. Would you like to see that? And the EMT, there's multiple ways to do that, but the EMT basically answers yes. An audit takes place of that, and so that all that information and the person looking at that information is audited, and that information comes down to that EMT's mobile device. And on there, it basically walks through some things and some medical history, and they just discover that you or me, lying there on the street, no idea what's going on, that you're diabetic, right? And so maybe you were out doing something and something happened or you couldn't get somewhere, so they basically discover that you're diabetic based on your clinical information they received from an HIE. Through additional assessment, they then give you an insulin injection, and boom, you wake up. And you start talking to the EMT, they find out that, yes, you were diabetic, you had left your gym bag at home that had all your medications in there, and as you were walking to work or out on a run or whatever it may have been, you basically passed out, not knowing it, really. So they are able to retrieve all that information, put you in the ambulance, and take you to the hospital, at which time an emergency room physician would look at you, clear you for being released back into the world. And once you're released back into the world, they have basically another encounter. You know, the HIE is now got another encounter where you receive some type of clinical help, and that goes back up into the HIE itself. So now, a week later, when you go to the doctor because you got a bruise on your head or something like that, and he starts looking at your record and he says, well, maybe you got it because you fell in the middle of the street, because we got this information from the HIE. So hopefully that's what we would like to see, is that information flows freely between the HIE and providers of care, and that they can help in an emergency situation like that. So HIEs in critical access hospitals, what are the benefits? You know, how do critical access hospitals benefit from HIEs? Really, that longitudinal patient record. They get all the information that could have been provided by any participating site, facility, provider, and it's for you, for your benefit. It's for the patient's benefit in an emergency situation. And you would want to make sure, being a patient, that anyone treating you had all the information available. And so creating that longitudinal patient record is definitely a benefit for you as a recipient. And you get to contribute to that by any encounters that are received at your facility, sending those back to the HIE. It gives the care providers, you know, the ability to make information available to anyone that supports you from a care perspective. So if you're have elderly parents or grandparents that you're actually having to support and want to provide medical information for, that information can be sent to you, and so that way you can provide that to additional providers. Easy access to patient records in an emergency situation or away from home, so you can check the information yourself. If your HIE, if the HIE you're participating with has the ability for a patient to log on with a patient portal, they can go in and check all the records and see all the information they need to see and want to see, and actually could maybe print that off for someone at a facility that's not connected to your HIE. And then as an HIE participant, information can be integrated into the EMR workflows. So giving the provider of care the ability to go through their normal workflow but receive additional information. So this integration from an HIE to an EMR or EHR, you want that to be seamless, and it seems like that the provider's just working on their system as they normally do, but they're receiving a lot more information into their system. HIEs and large healthcare organizations, both providers and IT staff benefit from HIE connectivity. Obviously, it's centralized, so data is sent to one place. We make a connection to, and if we want to receive information, which normally you do, you would make a connection from, and you may have a couple of different types of connections. Normal HL7 transactions could flow across. You could have document exchange through IET profile, so there's different ways of getting information. Usually it's just one connection through a VPN type connection. So you open a pipe, you can send information back and forth on that pipe. It's distributed across the community. It's available for the community and anyone that has a relationship with that patient, whether it's an attending, a referring, a consulting, ordering doctor. All those people have that information available to them. Aggregates the community records. So again, getting information from multiple sites, multiple sources, then you can aggregate that without duplicates into a document, or that can then be routed on to different individuals that are caring for you as a patient. And receives information by critical access hospitals. You're contributing back to that HIE. So you can route a multitude of results or documents or reports or anything up to the HIE itself to help benefit the patient. So as a result, the interface costs and IT costs are reduced. You have a central connection. You have a lot less support. You're just looking at that one connection versus multiple connections to different facilities throughout a geographic region, we'll say. Benefits for the IT staff, we talked a little bit about this, but basically connected to a single source and not multiple points. You're working with one connection point. And you can send all kinds of stuff, right? You can send HL7 flat files, CDA documents, PDFs embedded into HL7. There is a multitude of ways to send information to an HIE, and that should be available with an HIE that you're looking at. And it's secure. We want to make it secure. We want to make it HIPAA compliant through VPNs or certificate-based, or even a direct mail solution with a HIS. You want that to be secure. Obviously, PHI is we don't want any breaches. We've seen that with certain other corporate organizations, Target being one of those, where a breach does occur, but we don't want that to happen in the healthcare. We don't want that to happen in healthcare. And a technical backbone to architecture. So there may be things within your facility itself that you might not have the budget to do, or the time, or the resources to implement. And so by connecting to an HIE itself, you get the ability to send things up to the HIE that can then route them on to public health entities like immunizations or things like that. And you don't have to go in contract with Medicaid or Medicare or any of these public health organizations, or receive benefits from things like Allscripts or SureScripts or any of those organizations that would provide different services that you as an organization might have to go out and contract and set up on your own. And ability to meet meaningful use in a faster, more economical manner. So, MU is something everyone is concerned with in the healthcare world, that a provider is providing providing care for. And so, obviously, don't want to get penalized, don't want to get the most we can out of our financial side. Benefits for the providers, obviously greater access to patient information. We get more information from more sites. We're not having to worry about a patient bringing that information in hard copy format, or remembering all the meds they took, or remembering the type of test that they took or received, those types of things. So you get greater access to patient information from different facilities. Again, lots of ways to communicate through those channels. To ask, you could ask questions through a direct mail conduit, so that if there's a provider at a different facility that you may not have secure email with, you could go through a direct email that you guys both have subscribed to, and then share information, not only questions, but also, hey, on this result, can you check this out, kind of thing. And providers can collaborate much better. Access to the information anywhere. If you're on the road, you're doing your rounds, you're in vacation, a lot of people still check emails, can get on a phone. All that information is available if you have the secure access and you have the ability to get to that information. Reduces redundant or unnecessary testing. So you see the results of previously ordered tests. And obviously patients don't know all the names of the tests, so they may have forgotten and didn't know that they had that test, but you can see that as you log on and get this information. So reduce that redundancy that may occur when you don't have a result that you're looking for. The patient doesn't know if they had the test, but now you have access to more ways of getting information and can look for that test itself. And hopefully to reduce healthcare costs. We want to streamline the process. We want to keep redundant tests down and rule out certain illnesses or causes of illnesses quicker, and provide care for the patient themselves. Additional benefits. Again, ability to confer with other providers. Having that ability to send an email securely with some type of PHI in there and not having to worry about that. So through a direct mail type consult, or if a provider is on the same HIE as yourself, you can ask them to just log on, create a relationship with the patient, and look at those types of results. Direct mail obviously adds to that ability of sending attachments and secure documents across, even radiology images if you wanted to. You can go into data analytics. So if your HIE would then give you the ability to look at different outcomes for certain diagnosis or review population sectors within a certain geographic location. You can certainly do that. You can look for, review for things like fraud, people at multiple facilities using the same Social Security number but not using the same demographic information. So you can look for those types of trends in there from a fraud perspective. Obviously, drug seekers, seeing if they're going to different facilities looking for drugs, and then hopefully maybe better manage hospital readmits and see where patients have been traveling to and what their true objective is, if it is health care and to get care, or if it's an alternative type motive. Feedback on critical results and alerts. So, you know, if a test comes back abnormal, that can be presented to a provider in various means, not only in with an HIE itself, but that can be an email that comes back and says you need to take a look at this test for this specific patient record. So it helps provide decision support. It helps notify in the case of alerts and of abnormal tests. And HIEs, you know, help achieve national goals for meaningful use requirements and new payment structures as ACOs start becoming more abundant, or any type of bundled payment, patient-centered medical homes, those types of things. Federal and the ability to receive federal incentives. So if there are incentives out there for specific grants and your HIE takes advantage of that to add technology to the HIE or to add a different connection point to that HIE, you receive that benefit. And then ONC, obviously, they have a desire to see HIE succeed, and they've defined not only funds available for HIEs, but different goals that HIEs should follow, set clear goals for the HIE, and how do they measure success, that HIEs develop policies and standards that they all go by, and that they have a governance out there, and ensure patients remain at the center of an HIE and can access their information. Obviously, we want to treat patients, we want to provide the best care we can, and the patient is at the center of an HIE, and that's their goal. So what are some of the things to look for when you're selecting an HIE? Really, models of funding and sustainability. How did the HIE get set up, and how are they going to sustain themselves? If an HIE got set up with a grant, most did, how will they continue on and be self-sustaining? So you want to make sure that you understand that from a clear picture of how an HIE will sustain themselves. And if there is a financial impact for you joining that HIE, and that it's manageable and that you receive a lot of benefit for that payment to the HIE. And then what are their requirements for you to participate? BAA agreements, again, financial. Do you have to pay a monthly fee to join the HIE? Those types of things. The technology and forms of exchange supported. Do they support everything that you want to support? Do they support the things that are cutting edge and that everyone will be going to at some point in time? Do they support everything for your EMR? And can your EMR actually seamlessly integrate with that type of technology? And then any non-economic benefits of the HIE. What types of indirect return on investment? Will I get more patients because they know I'm connected to an HIE and are part of a network to receive a lot more information? Did they go to doctors in specific regions, and all those providers and all those facilities are connected to an HIE? So if I pick one of these providers, they'll have all my information, and I won't have to worry about that. So some benefits for patients understanding how HIEs operate and how that helps them to be at the center and receive all that. That's just a good non-economic benefit right there. And risk or liabilities of joining an HIE. Again, financial. Are there timeline issues that you need to look at? Hopefully they've not had any data breaches and that they are secure, so you want to verify that that's out there, that they have a policy around their connectivity and how participants connect in, those types of things. And then questions compiled by the ONC for your EHR. So when you're looking to join an HIE, maybe you have some of the capabilities of becoming an HIE yourself or hooking up to an HIE. So you want to explore what your EMR or EHR offers from a connectivity perspective. Does your EHR or EMR, do they have an HIE? Maybe you have an EMR or EHR that has an HIE capabilities built into it that you can utilize. Privacy and security features, what are those for your current EHR or EMR? What forms of exchange does your EHR provide and support? CCD exchange, IHE profiles, all those good things that are out there. What are the maintenance and monthly costs of upgrading to include HIE in your EMR or EHR? So if you had to include some type of HIE connectivity pieces or those types of things in your EMR, is there an upgrade to a specific version of software that you're going to need to get to? And ongoing costs of including HIE to your EHR. And if you do have HIE functionality, do you plan to integrate HIE into your EHR at some point? What are your future plans? What's your timeline? Is there an upgrade plan? Do you need to be at a certain spot at a certain time to not receive financial dings as you move forward? Best practices when joining an HIE, ensure network expertise, VPN connectivity to an HIE, some secure fashion of connecting to that HIE itself, because you are sharing PHI data. It's going out there across space or on the line, as the internship says, on the line. Look for integration experience and ability to make changes for your existing interfaces. You want to have that ability on your staff. Integration experience for new items into your facilities, so results, CCDs, can that be received into your facility itself? How do you join up and what do you get? And how easily is it for me to make changes on my side when looking at getting this information? And plan for testing time to ensure you're sending and receiving what you want, what you need, and what will help you in the future. Also, ask for current things, ask for things up front. Get the specifics before you get in there. Get sample messages from an HIE. Document and test against those specs on your own. Just ways to help you decide if this is the HIE I want to join, how easily it's going to be to connect, and the possibilities of me connecting in a short time frame. document and test against all those specs and automate your testing if possible, and then document how you connect it, because it not only helps you, but you might have other facilities with different EMRs within your organization that may need to connect to the same HIE. So being able to share that and use that again to repeat the process, you want to be able to document that and be able to easily connect up with other EMRs if it needs to happen. And then proving the value to your organization. You know, you're going to have to go through a little bit of a process that when you look at HIEs and determine man hours, upfront costs, right? So how many man hours is this going to take me? What are the fees for connecting up to this HIE? And then what am I going to have to do long-term to support ongoing fees or actually ongoing technological items, right? If the connection goes down, is it a one alert type deal and we bring it back up and all is good? Or do I have to have a staff of many in order to monitor that connection? Hopefully it's just monitor a connection. If it goes down, you're notified and you can bring that connection back up and you still receive all that information. Define the anticipated savings and revenue generated. You know, do you get grants if you join the HIE? Do HIEs have grants that can help you join the HIE? And then revenue generation through time and efficiency. Are you going to get additional revenues because you're saving time by connecting to this HIE? And, you know, then compare your return on investment, obviously, to your upfront cost and see if it makes sense, how long it's going to take you to recoup some of those costs. And then evaluate your resources. If you're lacking project management or testing or integration experience or any experience that you feel you would need to connect to your HIE, start looking at other folks that may be able to help you and what that cost would be. You don't want it to be a long, drawn-out process, and if you don't have the expertise on staff, obviously you may want to look outside at different organizations that can help you along the way. How to get help if your staff is overwhelmed, if your resources are tight, if you don't have the expertise there. You know, obviously we've done that. We've worked with many HIEs. I've worked not only with HIEs but also EMPIs and message brokering. So we have a lot of experience that we can help with that. We've assisted many HIEs in setting up their platform, so we know what some of the HIEs are out there. Idaho is a good example that we took. They were on a specific vendor. They decided that the cost was too great for them with that vendor and didn't receive enough of the types of services that they were looking for to grow and that their participants wanted. We helped them choose another vendor. We're helping them through the process of then integrating to that other vendor. So there is an expertise out there. We're obviously not the only one. There are other third parties that have helped move that along also. More of the folks that we've helped with were some of the New York exchanges that were really first on the block to bring up a health information exchange and help move through that process and seeing technology change. So we have helped quite a few of those. And then, you know, looking at EMR vendors, who will be able to help you if you need help with your EMR itself or your EHR, who has Meditech experience or McKesson or Epic or Cerner or Greenway or ECW or any of those types of EMRs that may be connecting up to an HIE. Do you have that experience? And, you know, those are some of the bigger EMR EHRs, and there may be small ones that are out there that, you know, that seems that they pop up every day that they have an EHR that no one's really heard of, but it's very connected or very configurable. Sorry. So now we'll move into some questions and answers, hopefully answers, if you have any questions. So just wanted to open up the phones now, and Michelle, see if there's any questions that may be out there.
Okay, I just want to let everyone know that if you do have a question for Rob, please enter it into the questions pane on your control panel. And I do have a couple of questions. The first is, what's the best way to evaluate the health of an HIE, and how do we know if it's going to survive?
Great question. You know, it's good to obviously see how they got started, what their technology or their platform is currently. So did they get started with a grant? Did they get started because a lot of facilities went together and gave them funding to get started? And if those facilities did provide them funding, are those facilities still providing them funding in the means of maybe sorry, a monthly fee for the HIE to continue to run, and those as they bring on other facilities, they're going to charge that fee also. So definitely a great question on how they got their funding, how they want to or will continue to stay sustainable. If you joining means that they're going to meet their quota or meet their budget for the next month, that's probably not the best thing. You want to make sure that they will be sustainable, that they're still pursuing grants. That's always a good question to ask your HIE. How did you get started? With what grants? With what funding? How do you sustain yourself today? And are you sustainable? Perfectly legal question to ask, right? How do you maintain yourself? And then are you going after additional grants that are out there, SHIP grants, things like that? So definitely want to make sure that they are sustainable and that they do provide a technology that you may not have the ability to implement in your own facility. So I think that answered the question.
Okay, thanks. I have another question. If my EMR is charging, is there a way for me to offset that cost? What if the HIE charges? Will I have to cover these costs and any grants for my practice?
So is my EMR charging? I'm assuming that's on a per month basis for maintenance and support for your EMR. Some HIEs do offer the ability through grants to hook up to the HIE without paying for it, right? So basically your hookup fee is free, and you may get a discounted rate as you go through each month to month. Some HIEs themselves, I haven't seen many, but some do offer the ability to connect, and they're all federally funded or granted. Not sure that those will be sustaining long term, and I don't know if there's a way to offset the cost of an HIE with what you may be paying for your EMR. Obviously, if you could get rid of your EMR and join an HIE that had all the same features and functions and had a built-in EMR, you could just pay one fee for that specific HIE and get the benefits of an EMR within their HIE itself. Hopefully that answered the question.
Okay, I have another question. Which EHR seems to be the most compatible with the majority of state HIEs?
Which EHR? I would say there's a lot of different ways EHRs connect. I wouldn't say that one has more of a connectivity feature than any of the other ones out there, but your larger EMR vendors have the IHE profiles that are fairly standard and can connect, have HL7 transactions that go back and forth and connect to an HIE. Some have the ability to integrate workflows, and you want to look for that. So I can't say that there's one that connects the best. There are a few that connect better than the rest, and you know, I could probably answer specific questions about specific EMRs, but each would have its own goods and bads, I guess you could say.
Okay, there are no more questions at this time.
That sounds great. Again, there are multiple. If you don't have the expertise in-house and you need assistance, there are several folks out there and several resources on the internet that can help you when looking at HIEs. So I would hope that you would go and review some of those and look over some of those that could help you ask the right questions of your HIEs. Obviously, we're here that we can help and guide you along the way. And appreciate your time today.